Hello, my name is Iris Frazier, and I will be presenting today on flexor tendon repair protocol, specifically for zones 2 and 3, weeks 0 to 6. We're going to start our presentation with some important anatomy, specifically for the flexors of the hand. We are also going to go over the zones of the hand, some splinting that is used during flexor tendon repair post-operative, and then we are going to go into specifics of weekly protocol, as well as tendon glides, which are an intervention that are included in the later weeks of rehab following a flexor tendon repair. So let's jump into anatomy. What anatomy is affected by a flexor tendon injury? We will get specifically into that when we jump to nerves and muscles, but I want to start off by pointing out the digit numbers. Digit 1 starts with the thumb. So this is digit 1. Digit 2, digit 3, digit 4, digit 5. Abbreviated as D1, D2, D3, D4, and D5. Important to remember, as I will be referring to them as such throughout the presentation, and if you are a hand therapist in the future, you will be referring to them as such as well. Okay, let's start with the nerves. The nerves that are affected in flexor tendon injuries include the median nerve, the ulnar nerve, and the radial nerve. The radial nerve is affected if the thumb experiences a flexor tendon rupture. The median nerve is affected if this past the MP and the IP of the thumb, if that is experiencing a flexor tendon rupture or repair, as well as D2, D3, D4, half of D4. If any of those experience a flexor tendon repair, that is the median nerve. The other half of the ring finger and the pinky are innervated by the ulnar nerve, in which case, if there's a flexor tendon repair or rupture for those digits, the ulnar nerve would be affected. Moving on to muscles. A little complicated, but let's start by saying the flexor digitorum superficialis is superficial to the flexor digitorum profundus. In other words, the flexor digitorum superficialis lays on top of the flexor digitorum profundus. How can we remember that? I think of it like this. So if somebody were to say something profound, it's something that's really deep and intellectual. So, keyword being deep. Superficialis, meaning it's superficial, just like if you were to say somebody has a superficial personality, they only care about the way they look or the clothes that they wear, things that are on the outside, that's superficial. So, flexor digitorum superficialis, the FDS, let's start with that. That is the primary flexor of the PIP joints, these guys here. I also labeled them on this picture. And it also assists in flexion of the MCP joints. The flexor digitorum profundus flexes the MCP and DIP joints of the index, middle, ring, and little fingers. As you can see in my picture here, the FDS is in green, and it only goes to the middle phalange. The FDP goes all the way to the end. So the FDP flexes the DIPs. As you can see, this is my FDP working right now. And then the FDS is the primary flexor of the PIP joints. As a side note, which we will get into, right now what I'm doing is joint blocking to show you that I am only flexing my PIP joint using my flexor digitorum superficialis, FDS, and now I am only flexing my DIP joint, which is my flexor digitorum profundus, FDP, moving that. Moving on to the thumb. The flexor pollicis brevis, which is in that dark blue color, flexes the thumb MCP. Again, I'm going to joint block. And the CMC. So the CMC and the MCP, that flexion of those two, by means of the flexor pollicis brevis, the FPB, allows for opposition for the thumb to the pinky. The flexor pollicis longus, the FPL, in light blue there, flexes the IP of the thumb. Again, I'm going to joint block. This is my IP flexing through the movement and initiation of my FPL. The FPL also contributes to the thumb MCP flexion and wrist flexion. So these are the muscles that are affected by a flexor tendon repair. Moving on to the zones of the hand. There are 5 zones, starting from the tip to the wrist. As you can see in my picture here, 1, 2, 3, 4, and then 5. I think it would be helpful if you were to pause the video right now and draw this on your hand. Drawing and writing is a cognitive tool to help you remember things. So I think it would be beneficial and helpful for you to draw it down your hand to remember. During my hand therapy placement at Cora Physical Therapy, I was asked to do exactly that, and it did help. I also want to point out that today we are going to be focusing on zones 2 and 3. So when I get to the flexor tendon protocol, I'm specifically talking about zones 2 and 3. So go ahead and pause the video and draw that on. I think it's pretty self-explanatory. Again, 1 to 5 goes this way, but it is helpful. It's important to know why do we even have zones of the hand? Because that is a tool for the orthopedic surgeons to let other medical professionals, including occupational therapists, know the location of the flexor tendon injury, as well as, of course, the surgery, the repair. So at this time, you should have already paused the video and drawn that on your hand. Look at it. Do it as much as you need to. These are good to know. I also want to give you another helpful tip. There are 5 zones for the flexor. Flexor side of your hand has 5 zones. There are more zones on the back of your hand for extensor zone, but when you learn that down the road, just remember flexor 5 zones. Flexor 5, FF, flexor 5. Okay, moving on. So we're going to get into splinting. When our patients experience a flexor tendon rupture repair, the orthopedic surgeon ends up putting them in a dorsal blocking splint. What does that look like? Here we go. You can go ahead and read the degrees of flexion that the dorsal blocking splint is encouraging. But yes, so we want it kind of in a flexor pattern. Why? Why do we want it in a flexor pattern? Because it promotes optimal healing. If we have a flexor tendon cut in half, are we going to want to extend it past its limit and potentially snap it again? Of course not. If we have a rubber band that's weak, the more we stretch it, the quicker it is to break, right? So the tendons are kind of like rubber bands. If we stretch it, it's going to break. It's weak. It's still going through healing. It's repairing. We do not want to extend it, which is why we put it in a dorsal blocking splint. We want to keep in a flexor pattern. Another fun way to remember dorsal the dorsal fin, right, on a dolphin is on their back. So the dorsal part of your hand is on the back of your hand. So dorsal blocking splint in a flexor pattern, these are the degrees that they promote, that the DBS promotes. Okay, when is a dorsal blocking splint discharged? Whenever the orthopedic surgeon tells you to, or tells the patient to, essentially. Typically, that is in weeks 4 to 6, sometime between there. But ultimately, it depends on the patient's range of motion and scarring. With that being said, if the dorsal blocking splint is discharged, a post-operative flexor tendon brace may be prescribed following the dorsal blocking splint. But again, that is up to the orthopedic surgeon's discretion and is dependent on the patient's range of motion and scarring and general healing process. Okay, so that is the basis of what we have for our flexor tendon repair. I am going to move on to the weekly protocol and the tendon glides in a separate presentation because I am limited on time here. So I also think it would be helpful to have them separated for studying reasons. So this is the end of this specific presentation, and I'm going to go ahead and direct you to the next one.